Oh, hey there! Welcome to the Rapid Question Series, where we break down complex topics into quick, digestible insights. Whether prepping for an exam, brushing up on key concepts, or simply sharpening your knowledge, this series is designed to deliver concise, clear answers at lightning speed. Let's dive right in and tackle your toughest questions fast. A once tired 18-year-old woman came in feeling low energy, lost weight, and had trouble sleeping and concentrating. No major medical or psychiatric history, so she was put on meds. Fast forward 3 weeks, and now she's planning a world peace tour after not sleeping for 3 nights. She feels amazing. Her wallet is lighter from splurging on plane tickets, and her mom casually mentions a family history of mood swings. What meds did they start her on? Zoloft and other antidepressants are typically only used in bipolar disorder when combined with mood stabilizers like lithium or valproate to prevent the triggering of manic episodes. Mood stabilizers help balance the risk of SSRI-induced mania. A 66-year-old guy keeps fainting like a swooning Victorian after feeling dizzy and having his heart race. He's passed out 3 times in 6 months, but no chest pain or trouble breathing. He's got the usual hypertension and high cholesterol, but no family members. His ECG and echo are expected, so they go full-on spy mode with a cardiac electrophysiology study. They inject some mystery med and boom! Interesting things happen that is shown on the graph. What medication was administered to him? Isoproterenol is a potent, non-selective beta-adrenergic agonist that primarily affects the heart by stimulating both beta-1 and beta-2 adrenergic receptors. Here are its primary effects on the heart. Increased heart rate, positive chronotropy. Isoproterenol stimulates beta-1 receptors in the heart, leading to increased heart rate, tachycardia. This effect can be used clinically to treat bradycardia, slow heart rate. Increased contractility, positive inotropy. It also increases the force of contraction of the heart muscles, improving the strength of the heart's pumping action. Vasodilation and decreased vascular resistance. By stimulating beta-2 receptors in peripheral blood vessels, isoproterenol causes vasodilation, which leads to a decrease in systemic vascular resistance. This can lower diastolic blood pressure. A 23-year-old woman comes to the ER rocking a fever, chills, and sweats like she's in a bad action movie. She's fatigued, achy, and headachy after returning from a 3-month gig in India. Fun fact, she had these same symptoms while abroad, but they disappeared with treatment. Now she's back, mildly jaundiced, and her liver and spleen are swollen. Blood work shows anemia, and a blood smear reveals ringed inclusions. What sneaky infection has come back to haunt her? Hypnozoites can reactivate after a period of dormancy, releasing merozoites into the bloodstream, which then invade red blood cells and cause a relapse of malaria. This is why people infected with P, Vivax or P, Oval can experience recurrent bouts of malaria, even after the initial infection has been treated. Reactivation is often triggered by factors such as stress, weakened immune function, or other illnesses. Medications like primaquine or tafenoquine are used specifically to target hypnozoites and prevent these relapses. A 57-year-old guy who got a new set of lungs due to severe emphysema is now struggling with breathlessness and a persistent dry cough. Despite being a model patient with no smoke-filled scandals, he's got some interesting crackles and wheezes when you listen to his lungs. His breathing tests show his FEV1 has nosedived, while his FVC is chilling like nothing's wrong. Docs think his body might be giving his new lungs the cold shoulder, so they're planning a peek inside with a bronchoscopy. What part of his lungs is likely getting the brunt of this rejection drama? Obliterative bronchiolitis, OB, also known as Bronchiolitis Obliterans syndrome, BOS, is a serious and common complication after lung transplantation. It is characterized by progressive inflammation and fibrosis of the small airways, bronchioles, which leads to their narrowing and eventual obliteration. This condition significantly impacts lung function and is the leading cause of chronic lung allograft dysfunction, CLAD, in lung transplant recipients. A 54-year-old man with a history of heart failure that laughs in the face of meds and a past episode of chest radiation for non-Hodgkin lymphoma, shows up in the ER completely wiped out and short of breath. Despite the hospital's best efforts, he passes away 3 days later. Autopsy reveals his heart was wearing a tight, fibrous coat in the pericardial space. What sign might have tipped off doctors about this stylish but deadly heart accessory just before he died? Kussmaul's sign is a physical finding that suggests impaired right ventricular filling, commonly seen in conditions like constrictive pericarditis and restrictive cardiomyopathy, and it is identified by a paradoxical rise in jugular venous pressure during inspiration. A 59-year-old man rolls into the office complaining of 3 months of fatigue that could beat a sloth in a sleep-off, and back pain that's got a real attitude about movement. Upon checking, his back's sore in the middle and lower regions, he's a bit low on hemoglobin, and his calcium's high enough to think it's climbing Everest. After poking into his bone marrow, the docs find some interesting stuff. The patient is at greatest risk to develop which systematic disease? The answer is patients with systemic amyloidosis typically present with multi-organ involvement, and symptoms may range from heart failure, kidney dysfunction, peripheral neuropathy, and GI issues to more subtle findings like fatigue and weight loss. A 46-year-old woman strolls into the office struggling to swallow anything from water to waffles, and often does a regurgitation encore mid-meal. She's also rocking some weak limbs and a stylish rash, with a splash of red on her eyelids but otherwise clear on the physical exam. Lifting her arms and standing up seemed like an Olympic feat for her. What's behind her swallowing saga? Perifascicular atrophy is more commonly associated with dermatomyositis, while polymyositis can also lead to swallowing difficulties due to muscle weakness, but lacks the characteristic perifascicular atrophy seen in dermatomyositis. Both conditions can cause dysphagia due to involvement of the proximal esophageal muscles. A 13-year-old with a flair for disrupting class by turning it into a shoeless scratch fest has everyone puzzled. His special ed teacher has noticed this for weeks. Out come the shoes, and the itch fest begins. Aside from his learning disability, he's a healthy kid, but his toes tell a different story. They're red and scratched up like he's been foot racing through brambles. A peek under the microscope at his toe jam reveals the culprit. What's the best way to give his itchy toes the boot? The first-line treatment for Tinea pedis is over-the-counter or prescription topical antifungal agents. These can be either over-the-counter or prescription medications, depending on the severity of the infection. These treatments are applied directly to the affected area and are effective at clearing up the infection in most cases. A 6-year-old daredevil wipes out on his bike and ends up in the ER sporting a gnarly gash on his left leg. Post-crash, he's patched up with some stitches, but a routine blood draw steals the show with plasma that's creamier than a pint of the finest ice cream. Turns out, his plasma lipoprotein lipase is taking a nap, even after a heparin wake-up call. What funky side effect might our little cyclist cruise into if this buttery situation goes unchecked? By causing inflammation, microvascular damage, and toxic effects on pancreatic cells, hypertriglyceridemia can trigger acute pancreatitis, a potentially life-threatening condition that requires prompt treatment. A 65-year-old foodie with a flair for the finer things, like steak and wine, finds himself in a pickle. He can't swallow his favorite chews, but can still sip hot drinks just fine. Doubling up on his heartburn meds didn't help, and he's mysteriously dropped 15 pounds. Despite a cocktail of meds for other ailments, a sneak peek inside with a scope reveals a party crasher, a 4-centimeter mass throwing shade in his esophagus. What's the likely culprit behind this unwelcome guest at the gastro gala? Obesity, especially central or abdominal obesity, increases intra-abdominal pressure, which in turn promotes the reflux of stomach acid and bile into the esophagus. This condition is known as gastroesophageal reflux disease, GERD. Chronic acid exposure due to GERD damages the lining of the esophagus, causing inflammation, esophagitis, and potentially leading to the development of Barrett's esophagus, a precancerous condition where the normal squamous cells of the esophagus are replaced by columnar cells. Barrett's esophagus significantly increases the risk of esophageal adenocarcinoma, as the altered cells are more prone to becoming cancerous over time due to persistent acid exposure and inflammation. And that wraps up our discussion for today. I hope you found it valuable and enjoyed watching as much as I enjoyed sharing these insights with you. If you liked what you saw, please hit the like button and subscribe for more content like this. Your support really motivates us to keep creating excellent content. Also, if you have any thoughts or questions, drop them in the comments below. I love hearing from you, and I'm eager to join the conversation.